On this video, I want to take a look at some of the blood vessels in the abdominal cavity. This torso model does a very good job of depicting most of the blood vessels that are of concern to us in the abdominal cavity. Remember, we came down as thoracic aorta, and then we passed through the aortic hiatus at T12, we become the abdominal aorta. The abdominal aorta has both paired and unpaired branches. I'm going to discuss the paired branches first. On this model, they only show going to one side, but this happens to both sides. At the T12 vertebral level, we will see a blood vessel that comes out and goes out onto the inferior surface of the diaphragm. That is known as the inferior phrenic artery. The inferior phrenic artery. We can also see on this model the kidney, and the yellow on top of the kidney represents our suprarenal glands. The suprarenal glands. We can see coming from the inferior phrenic artery into this suprarenal gland a superior suprarenal artery. There should be a middle suprarenal artery. We cannot see it on this model, but we can see on this model coming over to the kidneys, kidney on this side, the kidneys removed on this side, the renal artery. And coming into that suprarenal gland off of the renal artery is the inferior suprarenal artery. So we had a superior suprarenal artery. There should be a middle that is not shown on this model, and an inferior suprarenal artery. Paired vessels in the abdominal cavity. Also, the right and the left renal arteries, paired vessels in the abdominal cavity. We have one more set of paired vessels in the abdominal cavity. They leave the abdominal aorta at the L2 vertebral level. These are known as the gonadal arteries. Now, if it's female, they would be ovarian arteries. If it's male, they would be testicular arteries. Since this is an androgynous model, all we know is these are the gonadal arteries. Here they've cut the right gonadal artery off. We can follow the left gonadal artery down. So those are the paired vessels we can expect to see in the abdominal cavity. The unpaired vessels, there are only three. At T12, the celiac trunk. At L1, the superior mesenteric artery. At L3, the inferior mesenteric artery. The celiac trunk divided into three branches: the common hepatic artery, the left gastric artery, and the splenic artery. The superior mesenteric divides into several branches, which we will see in just a moment. Remember, superior mesenteric at L1, L2 were the gonadals, at L3, the inferior mesenteric artery. It's going to branch into three branches: the left colic artery, the sigmoidal arteries, and the superior rectal artery. Then at L4, this abdominal aorta bifurcates into the common iliac arteries, which then divide into internal and external iliac arteries each. Now I want to look at the venous return here for just a second, because the venous return is not balanced from the left side to the right side. All the blood is trying to return to the inferior vena cava and then back to the heart. Notice on this particular model, the gonadal vein on the left side goes into the left renal vein. But the gonadal vein on the right side, which we do not see here, goes into the inferior vena cava. So not to the renal vein, but to the inferior vena cava. Also, on the left side, the suprarenal vein comes from the suprarenal gland and goes down into the left renal vein, where the blood can then cross to the inferior vena cava. Whereas we don't see it on the right side, but that suprarenal vein goes directly from the suprarenal gland into the inferior vena cava. Now, if I put a portion of this model back on, we can look at some of the branches associated with the superior mesenteric artery. So we put the vessels back on. There are many branches here, but coming from that superior mesenteric artery and passing behind the pancreas and coming out right here by the Uncinate process, we have a series of branches that they have cut off here. These are known as the intestinal arteries. The intestinal arteries take care of the majority of our small intestine. We have one branch that works its way off to the lower right, where it meets the ileum and the cecum. This is called the ileocolic artery. we have many loops that form a vessel going along the ascending colon on the right side of the abdominal cavity. We call that the right colic artery. And then that will form loops that come across with the transverse colon. So I put my transverse colon on and we'll peel it up. We can see this vessel coming across with the transverse colon. This is called the middle colic artery. The middle colic artery. Those are the main branches from the superior mesenteric artery. There are a few other branches here, such as the inferior pancreatico-duodenal. We will not worry about those. Here we can see the inferior mesenteric artery, remember, coming off the abdominal aorta at L3 vertebral level, and it will branch to the left side of the colon where it forms the left colic artery. It will branch down to the sigmoid portion of the colon where it forms the sigmoidal arteries, and it also goes down onto the upper portion of the rectum where it is called the superior rectal artery.